Behavioral Health Today, a podcast by Tried Behavioral Health, covering trending topics in behavioral and mental health. This podcast is designed to share unique and relevant topics occurring within the world and our communities and bring them a mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor, and today I'm joined by Haesue Jo. Haesue is a licensed marriage and family therapist based in the Bay Area in California, with experience providing both individual and family therapy. Her clinical focus and interests include multicultural issues, anxiety, relationship and family dynamics, trauma, community violence, gender identity, and working with depression. Currently, Haesue is the clinical operations manager at Betterhelp, which is the world's largest online counseling service, allowing those interested to access a network of licensed, accredited, and experienced therapists. Today, Haesue joins us talking about Betterhelp's online counseling and their Telemental Health platform. Haesue, welcome to Behavioral Health Today.
Hi, Graham. Thank you so much for having me.
Really nice to have you be here. Well, let me start out by saying, wow, this is the world's largest online counseling service. Congrats on that. What is that like to be a part of a service like this?
Thank you. I guess I haven't really wrapped my head around it yet. I've been with the company for over 3.5 years now. And when I joined, we were but a very small company. And so I've had the privilege and honor to witness this incredible journey of growth. Yeah, wading through a lot of different things that I had never experienced before in my previous life as a traditional therapist. And getting to be part of it and having so much impact from the work that we do has been really, really incredible.
Fantastic. How exciting that is. It must have been fun, and it must be fun to be a part of that growth that's taking place, particularly right now in this era that we are in, not just pandemic related, but just in terms of IT, et cetera. Online services are occurring, which is really a benefit to those therapists that want to work and reach more folks and those people that want to have greater access to therapy. What a great venue to be working in. How many therapists, out of curiosity, are we talking about? Do you know, being a part of your service?
Yeah, right now we're in the ballpark. I say ballpark because we're adding new therapists every day.
Imagine.
But last time I checked, we're at about 13,000 providers. So these are folks that have at least one client on the platform, many upwards to far more than that.
Fantastic, man. So who is the typical, as well as the ideal in terms of a patient seeking services through your program? Who do you see coming through, I'd say your doors, but through your portal?
Prior to March of this year, I think that we did have a more focused type of person coming in, and we're looking at a younger demographic that's typically online all the time. Many of the users had never done therapy before at all and had come across some kind of advertisement on social media or word of mouth by somebody else. And of course, folks that have not been in therapy before, they may not have the language for what they're going through, but generally what we're seeing is anxiety, depression, adjustment issues, family, trauma, the stuff that you would see in most private practice offices. Now, post March 2020, now we're seeing even more kinds of people trying out these services. People that have been in offline in-person therapy before may not have access to do this anymore in a safe way. So now we have many more other kinds of people signing up. In addition to the things that I had just mentioned, we're seeing all kinds of stuff, right? It's like maybe stressors in a relationship or a friendship or grief, loss, even more stuff regarding adjustment, especially when it comes to financial stress or changes to somebody's routine, lifestyle. I mean, I think I could go on and on about what kind of person might sign up for this, because I think every kind of person can benefit from using a service that's so available, so accessible. Of course, if you have a really hard time with technology and figuring platforms out, and those kinds of things don't come very easily to you, it might be a little bit challenging initially, but the platform is designed to be as straightforward as possible. So even if you're not an engineer, you should be able to figure it out. And we have a dedicated team to help you figure out some of those things along the way if you do have questions. But it's every kind of person across the board in symptoms, severity, chronicity of issues, as well as age.
Yeah, really good. And just talking about your website for a moment and researching it this week and kind of going through a number of things in prep for today, it is very straightforward from what I'm seeing. And it's kind of a click and play. And you guys have made it very simple to get going. I was going to ask you about that. So if I'm interested, and you're talking about this is a service open to a wide variety of presenting problems, from a depression to an adjustment to all the challenges that are coming up during this COVID time, life changing so dramatically. just a variety of opportunities for people to come in. If I'm coming in your program, how do I go through the intake? What happens in that process? And how do I get matched up with a therapist that might be the best fit for me?
Right. So if ever you're interested, you just got to remember our website address, which is pretty simple, betterhelp.com. And on every page of the site, you're going to be able to find a link that says something like Get Started. And this is what's going to take you to the first question of our intake questionnaire, which is relatively brief. So you're going to go through and answer about 25 questions about things that you've been experiencing in the last 2 weeks or so, or maybe even the last month. And these are the kinds of questions that you would see in any kind of intake questionnaire when you're going to see a therapist for the first time, asking things about your sleep patterns, how you're eating, your involvement with substance use, or if you've been experiencing anxiety, phobic type of tendencies, depressive symptoms, all these things. So you finish this questionnaire, you get to a point where you might want to decide which subscription plan you want to sign up for. And I don't have the specifics off the top of my head, but people that are interested in cost can find out more at betterhelp.com/FAQ. And then based on the things that you've described, right, on top of the questionnaire, you get an opportunity to list out the things you're looking for in a therapist. So you might be wanting to get matched up with a female therapist for a variety of reasons. Maybe you're also looking for a therapist that specializes in working with anxiety, that also identifies as a person of color. So you have all these different things that you can choose from. And then what we're going to do on our end is try to match you to the best of our ability with an available counselor that matches these things that you're looking for. And that's based on the counselor side too. Counselors on their end are marking their areas of expertise, various things about their own demographics that help with matching purposes. And then, of course, we're checking for appropriate licensure. So in general, we're going to be matching clients with counselors who are licensed in the state of the place that they are reporting that they live. And then during this time, of course, a lot of states have issued emergency orders. So that's something that we've taken advantage of is the right phrase here. But we have a team that's monitoring all these different emergency orders and making it so that we can have some cross-state practice going on as well.
Yeah, I know some of those restrictions have been lightened a little bit, allowing people to access the services as necessary without the same kind of restraints that have been in place. I also know that being online allows interested patients the convenience as well as greater access to therapy. But I also understand that your program offers a number of ways to communicate with one's therapist, not just on a video chat, but there are other ways you can do it too.
Right. So once you get signed up and you're matched with your therapist, every time you log in, you're going to be on this main messaging page, which we refer to as the sessions page. So this is where you can message your counselor back and forth more in the style of an email. You know, you send a message today and your counselor might get back to you in a few hours, maybe tomorrow. And if you're looking for that more immediate feedback or an actual session, that's where you can go ahead and book a live session. And the live sessions can be video, but they can also be done over audio. So like a phone type of chat or even an instant message experience, which we call live chat. So those are the three types of live session that one can engage in with their therapist, and then they can supplement that with the messaging back and forth between sessions. So
really good.
The cadence of communication can feel and look very different if you've been in traditional offline therapy before.
Yeah, but this is expanding, isn't it? People's not just access to it, but their level of comfort in being able to connect and share and relate in some ways. So really nice opportunity to connect in a way that works for them too. You mentioned earlier about some of the populations you see in terms of those that are eligible for services, if you will, through your program, the age ranges, couples, families, individuals. Kind of give us the general composition of those coming in to seek services.
So if you're checking out betterhelp.com, this is a platform that's built for individual counseling specifically for adults. So you need to be 18 or over to sign up, and you're consenting for yourself to move forward with this kind of treatment. If you're interested in couples counseling, like you mentioned, that you might want to check out one of our sister sites that we do operate, and that website address is regain.us. It operates very similarly to BetterHelp with the messaging, the different kinds of live sessions. However, you can have two users on a joint account, and this makes it possible to engage in couples counseling. So two users have their own separate logins, their own passwords, and then they have a joint sessions page with their therapist. We don't quite have a service that's available for family therapy for many individuals of a family. However, we do offer teencounseling.com, which is a place where a teen and a consenting adult, so parent or legal guardian, can get signed up. So it is limited just to the teen and one parent, but we do find that a lot of parents will share their own login so that the parents can be engaged with the child and the therapist as well. So on teen counseling, the teen does have to be at least 13 years old, and they can be all the way up to 20 years old, since we understand that a lot of kids are staying home a little bit later these days.
Sure. Really good. How are you selecting your therapists, and how do they come typically to be a part of your program? How do you vet them? How do you check their licenses, like you said earlier? How's that process go?
A lot of therapists find us through word of mouth. They've had colleagues that have heard of this thing, or they've seen the ads that we're using to target potential users, or they've heard about us on some podcast. And on top of that, we're also doing efforts in terms of recruitment. So you'll find positions for Betterhelp counseling positions on all of the main job posting websites like Indeed or Glassdoor. And then we've also branched out into more ways to reach therapists in the States. So maybe we're looking at like CEU providers, or even reaching out to different universities, or finding ourselves at different conferences that are available for professionals in the field, or trade shows that exist for job fairs. So we're trying to get as creative as possible, since the demand for these services just continues to increase as the year progresses. Yes. And then in terms of what do we do once the therapist has found us and says they want to apply, they do have to go through an application process, and there is a clinical case study for them to complete as well. Once they finish the application, we do a background check. And so the background check is pretty thorough. And then on top of that, we are vetting their license by doing cross-reference checks with their respective governing boards. And we're making sure these licenses don't have any sanctions or open investigations on them. Very good.
So the person coming in really has the certainty and the trust that these are very skilled, expert, properly licensed therapists that they're going to be able to feel safe with and do the work that they need to be doing with somebody they can really trust. That's wonderful. When someone comes into therapy, how long are people staying in therapy online? Are you finding in the more traditional, you were saying earlier that people come into our offices, we see them face to face. A lot of people tend to work more long-term than others. Some work more in a short-term model. But what are you finding in terms of folks coming in to receive the services that they do from your therapist? How long is the treatment typically lasting?
You'll see kind of a similar pattern there. Some folks more short-term, and other people are here longer-term. So Betterhelp is, I think, about 7 years old now. And so we have some clients that have been on the platform for about 7 years. We have some users that are using this very long-term, and whether that's with the same therapist or not, it varies. And then, of course, we have a lot of people signing up really looking for short-term solutions, right? It might not be someone wanting to process every single detail of their relationship with their mother. They just want to figure out, how can I stop myself from panicking when I have to speak publicly in front of my colleagues? So it really ranges. We see people come in and out within a couple of weeks, all the way up to a few years they might stick around. And then with a provider network as large as we have built now, you're going to be able to find so many different approaches. So the therapists too are very diverse, and we have people that focus on psychodynamic work, which can take many years. And then of course we have plenty that are trained in the evidence-based practices that are a little bit shorter term. I think on average, people stick around for a few months, and really the hope is to, identify what their goals are and work together to meet them.
Yeah, that's really good. That's really good. When we see some folks in therapy, there are times when a really significant anxiety, or let's say a depression, is being presented, and there's a lot of mood instability and some challenges just to kind of maintain some emotional stability. And oftentimes medication can help address that instability and regain some control and allow them to then do the therapy work. In working with Betterhelp, if a therapist is seeing somebody, and let's say medication might be a helpful and necessary adjunct to the treatment that they're going to be doing together, how are those referrals made?
Great question. I do want to say we actually have a lot of users that sign up that are already on medication. I think we know that a lot of general practitioners, like family medicine, your primary care physician, they're going to try to help you out. And sometimes they'll prescribe to you some kind of medication that can help with your mood. Now, a lot of people like this are not in talk therapy, and they're signing up for Betterhelp saying, on top of this med that I've been given, I'd really like to now work on something because my psychiatrist actually recommended that I find somebody. So those kinds of folks are also signing up. Now, when we have somebody that's signing up and the therapist has identified after some time, perhaps you might benefit from speaking with a psychiatrist. It's
Right.
very similar in terms of what you would find in an office. Your therapist is going to work with you to try to find somebody local to you. And through our platform, the therapist can send an attachment, which might look like a release to exchange information with another provider to coordinate care and make that referral to a prescribing doctor, even just for an evaluation. So while those kinds of things won't be happening within the platform, the therapists themselves are the same therapists that you're going to find in a clinic or agency or hospital. They're trained to be able to coordinate care in that way if that's going to be the best course of treatment for a client.
I think that's a nice reminder. Basically, what's happening in the more traditional in-office visits is going to happen in the therapy as well. Just because it's online doesn't necessarily mean some of the treatments or some of the approaches to help somebody are going to be different.
Yeah, we're not trying to reinvent therapy or change the way that it's done. We trust that these professionals that have been licensed by a governing board know what they're doing.
Yeah.
And rather, we wanted to provide a different delivery service for how people can get access to this care.
Yeah, that's right. That's really good. When you think back on the treatment that you provided personally, you work with quite a diverse set of presenting problems, as I mentioned at the beginning of our time today. But when you think about the treatment that you provided personally and in maintaining confidentiality as we talk as always, share with me kind of a therapy story that might come to mind that you're proud of through the work at Betterhelp and an online platform.
Sure. I've really enjoyed the reach that these online counseling platforms have. Previously, like right before I started working at Betterhelp, I was working in community mental health. And in community mental health, you're working with a very specific population, very local to where your agency is located, folks that are on subsidized care, lower SES. And that was the world that I was followed up in for such a long time. So when I came here to Betterhelp and I saw wow, we're able to provide access to not just a particular group and community, but quite literally the world. It's been incredible to be able to bring my skills to the types of clients that I'm interested in. So
absolutely.
Specifically, I myself am Asian American, and part of my own identity growing up is what led me to want to become a therapist in the Asian American community. Mental health service, talking about what ails you emotionally, mentally is still very much stigmatized. And so this platform, I think, has brought access and brought the possibility for a lot of people who never would have set foot into an office. So the client story I'm thinking about fits this description, right? A young Asian American woman who had never been in therapy before and was actually referred to me by a therapist friend who's not part of this platform, but mentioned that I might be a really good matchup for this person. So referral was made offline, and then I was able to instruct her on how to sign up for help. And basically the things that she was coming to counseling for were some of the things that I think I went to grad school with, wondering how am I going to address the stuff that I've been having a hard time with when it comes to family dynamics, like communication issues, being part of a family that has differing levels of assimilation of immigrants, folks that were born here. And so it was very personal to me because so many of the things that she was going through, something I could relate to. And specifically her relationship with her parents, navigating how to be a young, independent American person while tending to the needs and expectations of your immigrant parents. So we worked together pretty briefly for about 6 months. And, she was able to work on different communication skills as well as kind of reframing the way that she thought about expectations and what that looks like in a multi-generational and multicultural family. And she took a break for several months and then she came back with a different issue. And to me, that was whatever happened for her here was effective enough to the point that she wanted to return. And that's another very easy thing about Betterhelp. As long as the counselor is still a provider on the platform, clients can come back quite easily. So I do appreciate that the platform supports this continuity of care so efficiently, which can be kind of difficult in different settings.
One of the studies I had read a while back is about 73% of the people that come into therapy and do that initial, let's say that initial block or that initial foundational work, and they gain some great, whether it's insights or skills, or be able to put some different endings on some very familiar beginnings in their lives and really grow. About 73% of those people that come in and do one round come in and do another set of rounds, and they return later in their life into therapy, much like what you're talking about with this client several months later. It's a nice opportunity for them to kind of experience what therapy is, to make some growth. And then as they begin to grow, they come into life differently, don't they? And they might even look at, okay, now that I've kind of tackled that area of my life, what's in front of me next? And how might I use therapy as a really helpful and beneficial resource to continue to grow in these other areas of my life now that I get to focus on because I took care of the prior things through the help of my therapist. That's a very exciting piece. I'm sure you see that fairly frequently.
Yeah, and that experience has been exciting to me because it's helping to normalize the idea of seeking out mental and emotional support. Like if you have back issues, then you probably see your chiropractor a few times a year, if not more than that. But I think some people have, for whatever reason, this idea or notion that you go to therapy once, and if you feel the need to return, something must be wrong with you. But my hope is that people can start to see that this is any course that you can come back to at different seasons of your life with different things that you want to work on. So that's been really exciting to be part of.
I love that analogy, similar to our physical health. We've got our mental health and our relational health. And, we kind of grow up doing what we know. And then we find ourselves in our adult lives replicating almost in a hand-me-down kind of a way, the things that we did early on. And we're doing kind of more of the same. And what therapy gives us an opportunity to do is to make the unconscious conscious. Why do I do that? Or why do I find myself in these relationships the way that I do in a repetitive way? And how might I be able to come into my life a little more mindful, a little more aware, a little more conscious, intentional? And what if I really understand what it is that I need most in my life that I've been chasing my whole life that maybe I didn't even know? That through the help of my therapist, I get to kind of open up the blinders and see, oh, that's what I'm doing. What if I began to be more cognizant of that in the moment when I'm doing it, maybe put a different ending on these very familiar beginnings so I can have a different ending ultimately and be able to really enjoy and experience some things in life that are very rewarding. So yeah, I love that idea that we get to kind of demystify and de-stereotype that therapy is for those that are not quite right. No, it's for all of us at any age range and socioeconomic range, being able to have someone come alongside us and really help us understand ourselves and join us in that growth process is really an exciting thing. You also talked about too, the idea that they get to come online. I love the idea too, with therapy, sometimes maybe still holding a stigma for some folks. The accessibility, one, from being online, but also to the anonymity that allows them to come into therapy without having to sit in the waiting room or take the bus down there to that office that's known as the therapy office, or maintain some privacy is a really nice additional piece for the online format, isn't it?
Yeah. I've noticed that clients online tend to open up a lot faster. We focus so much on the introductory phase and needing to build rapport, which of course still has its own manifestations online. However, I think for a lot of folks that have difficulties with emotion regulation, it can be very challenging for them to get deep and into their thoughts and their feelings with a stranger sitting right in front of them. But if you are now speaking to someone who's in the comfort of their own home, speaking to you through a device that they're very familiar with, something they use every day, I think a lot of times people are just more open and more willing to get vulnerable a little bit faster. And that's been an interesting observation for me. Yeah. And, we're putting a little bit more power back into the hands of the client. I think a lot of new clients will feel very scared coming to an office or even a hospital and just feeling like they're in this sterile environment that's super unfamiliar and a little bit alarming at times. Yeah. Some of my clients, they're taking their session calls. They mention that they're like in their bedroom or they're, they let me know that you might hear some voices in the background because I'm babysitting today or something like that. And it's like, wow, I get to meet my clients truly where they are. And I get to have this very raw experience of the client that I'm not seeing so much in my past life in an office.
You really do. You get kind of a therapeutic glimpse into their lives, whether it's the sights and sounds that you see online. And I like that idea too, that some of the barriers are removed, whether it's the transportation to get down there, whether it's the building you've got to walk into or the, whole check-in process. It feels like, it could be uncomfortable for some. All those barriers are removed. And it just allows a greater accessibility and a greater comfort, I think, as they come into that relationship. And I would imagine the trust has a really good opportunity to get built there just the same way that it does in an office as well. Really good. Haesue, give me some idea if someone listening would be interested in getting involved with the services that you folks provide through Betterhelp. How are they going to get in touch? Give us the site again and kind of the process to get it going with you guys.
Sure. You can find us at betterhelp.com. There's an about page as well as an FAQ. If you're a social media type of person, you can find us on Facebook, Instagram, and on YouTube, because then you can find some of the other things that we make available to folks that are not using the services if you need to dip your toe in a little bit.
Yeah.
And if you have any questions at all about the service, you can email us directly at contact@betterhelp.com.
Really good. Haesue, thank you so much for joining us. It has been great to find out about the services you folks are providing, ways for people to add therapy to their life in a very confidential, very effective, efficient, reduced barriered kind of way. So thank you so much for your time with us today.
My pleasure. Thank you.
Great to have you. And to our listeners, we appreciate you as well. Thanks for being with us today. And we'll look forward to seeing you next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Tried Behavioral Health Network, all rights reserved.